Hello everyone, welcome back to my channel. Today I'm taking you on a tour of Haniya's medical supply closet. This might seem like an excessive amount of stuff, but we use most of the supplies on a daily basis and get monthly shipments. It's also a good idea to have any backups in case of emergency. Don't forget to like and subscribe to my channel. For the boxes, I just took regular cardboard boxes and wrapped them in a beautiful silver wrapping paper for aesthetic purposes and used a label maker to label each box. The first box has 2x2 split gauze, and I'll link the video that shows me using this type of gauze. I use these for the dressing around Haniya's G-tube site. I like that these are already cut down to the center to wrap around the tube. Then I have tape that I keep right above the 2x2 split gauze. I have a silk tape that looks just like this and a paper tape. I like the paper tape because it's easier to tear off a piece without the need for scissors, and it's also gentler on the skin. With the tape, I also have an adhesive remover called Dedicol. We were introduced to this when we were in the NICU, and it's really helpful in reducing the pain when removing anything from electrodes to tape dressing. It also easily wipes off the excessive sticky tape residue. I keep the split gauze and the tape right next to each other because I regularly need the tape to hold down the ends of the gauze. Next, we have the syringes. I've divided them into 5 ml syringes and 10 ml syringes. We use the 10 ml syringes for water flushes or for dispensing medications. This is also a 10 ml syringe but with a different tip. These are also 10 ml syringes and they get used the most. Also, with the 5 ml syringes, I keep a bag of 1 ml syringes. These are basically used for Haniya's medications where we would need less than 1 milliliter drawn up for that medication. And these also come with caps so that we can cap the syringes when we are traveling. We also have 6 ml syringes, again with caps. These are all sterile and they're just delivered open like this to us. These are cotton tip applicators that we use to clean Haniya's G-tube site. I also have a video that I'll link showing you how I use it and prevented granulation tissue from forming around the G-tube site. And we have a ton of these, and this is basically what they're used for. To the side of the cotton tip applicators, I have Tegaderm. This is the larger size of the Tegaderm. I split this usually in half and use it to hold down Haniya's extension tubes. I also use this in a video if you want to see how we use it, but we don't use these anymore, so most likely we will donate this. This in orange is actually ulcer dressings. And these were accidentally sent to us when I asked for Tegaderm, and I'm sure they're great, but we've never had the need to use them, thank God. Off to the side over here, we have extra 2x2 gauze, and this is a Tegaderm size I was talking about that we use to hold down the G-tube extension. And again, we don't use these anymore now that we've switched to the button. These are electrodes that we needed when Haniya was on the Holter monitor, and I have a video on that I will link. I have tissues right here because you can never have enough tissues. And this box is where I keep all of Haniya's G-tube extensions, the Mickey extension tubes. These get used often. As you can see, I have a bunch of sanitizer. We use hand sanitizer for everything. Whenever I'm traveling, I make sure to have it in my purse. I have it next to her bed. I'm always sanitizing my hands to make sure she doesn't get any infections. And she is prone to infections because of her low immunity. Over here, we have some 4x4 split gauze, some extra gauze dressing that we keep just in case we need to use it. In the very back, we have a thermometer and we have some tongue depressors. This is random stuff I ended up putting into this one container. This stick has a green sponge at the end that we use for oral, sensory, and motor exercises. We dip the end in milk and allow Haniya to suck on it. And some more depressors and some more sticks. And we have a lot of lubricant jelly that we need in case where we would have to reinsert the tube if it gets pulled out. So these are very important. These are pre-filled 10 ml syringes with normal saline, which are used when traveling for tube flushes. I have two scissors in here. The blue one holds the G-tube closed. Also, it's not used often. And the other one is a regular scissor, which can be used to cut off pieces of the silk tape. Lastly, I have another full bottle of Dedicol in here for backup. We have Haniya's nasal decongestant, which we use once in a while, and it's called Nasamist. I'm sure that I've mentioned this in a video somewhere. Now that we're done with this row, let's move down. I've labeled this box suction because it's everything related to the suction machine that Haniya uses. We have different parts to the suction machine, and this one attaches to this tube and then directly to the machine. We also have this type of suction, which is a thin tube that we don't use. I like to use the little sucker for clearing out oral and nasal secretions. It comes in a yellow package like this. In the box labeled oxygen is anything related to oxygenation. We have nasal cannulas, and we have a bunch of them in the infant size. We also have pulse ox probes that are used with the oxygen machine that we keep. Also back here, we have this tube that is used for suctioning, which is mostly used for kids with trachs, and Haniya does not have a trach. This plain cardboard box is filled with just 60 ml syringes. We use a ton of these all the time. We use them when traveling, for bolus feeding, and also for venting. I make sure I always have one in my diaper bag. Back here, I keep the emergency G-tube boxes. I've talked about them in another video. These are pre-packaged, convenient kits of all the items you might need when changing the G-tube. I can link the video so you can check that out if you're interested. We have a ton of normal saline. I don't use this particular one because there's no way to seal this after using when you're traveling. I use this sterile water for flushes and for feeding. I use the Similac sterile water in 60 ml bottles, and I also have the Enfamil ones. They're all the same. I just use them for flushing after medications and for mixing up formula in between the many doctor appointments and weight rooms. These back here are irrigation trays that are used for wound irrigation if needed. It's a sterilized container that contains a piston syringe, tip protector, an iodine prep pad, drape, container, tray, and a CSR wrap. Alright, moving down. Right here we have Haniya's humidifier, some medications like suppositories, a breast pump that I no longer use. Down here I store her Similac formula and Adipac normal saline vials. At the very bottom in this cardboard box, I keep all of her kangaroo feeding bags. I pull out a new one every morning. and we get monthly shipments on these, so I'm ordering them fairly routinely. As a bonus, I thought I'd show you how I organize Haniya's daily medications in a box in the kitchen. These are her Onfi, the Sabrol, different medications that she's taking. I have a bunch of new syringes next to the medications. These are the syringes I am currently using, labeled with the first letter of the medication. T is for taurine, Z is for zonisamide, and so on. So I keep everything in one place and can pull it out as needed. Here is the Motrin. These are ones that she uses on a more frequent basis. I hope you enjoyed how I organize Haniya supplies. Comment below if you have any questions. I'll see you on the next one. Bye!